speaking. I wanted to make one more housekeeping announcement that I forgot. To keep us moving, we're going to hold questions for now because we are going to have a really robust discussion at the end of and some future sections. If you're looking for Wi-Fi, you want to use UCLA Web. That's accessible to anybody. You don't need a password to log on for that.
All right. Thank you. Oh. Yeah, I want to keep the podium on the stage. All right, I forgot to introduce myself actually earlier. My name is Patrick Allard. I'm a faculty in the School of Public Health here at UCLA, also in the Institute for Society and Genetics. And I will keep going with the topic of toxicity, but in this talk, actually, I'll orient it towards what else we should also be worried about in terms of what are the emerging issues that are of increasing concerns. I will end with some solutions. It's not all dark and bleak, and actually today, in general, is oriented towards solutions. So just, there's light at the end of the tunnel, I guess. So today, this talk will actually be about little snippets. I'll be jumping around these different issues and giving you some glimpses of the sort of hot topics in the field. I will actually start, and as I said, I'll end with solutions. I will start with that question of chemical substitutions. So, can we go to the poll everywhere question? So I don't know if you can see the question at the top. Have you purposely bought a container, like a water bottle, because it said that it was BPA free?
Because it said it was BPA free, or because I knew it was BPA free?
Because it said it was BPA free, because there was a label, a little green leaf, or something like that said BPA free on it. The no is getting on the yes. We have a competition going on. Okay, and there's nobody saying C, what is BPA, which is good. I purposely did not want to say what bisphenol A was, but I will now. Can we switch back to the presentation? Thank you. So it's a mix. We have yes and no. Unfortunately, we don't have time to explore why you still went ahead and bought a container, although it may have contained BPA. Can we switch to the? Oh, wait, no, that's me. Okay. So we'll talk about this question of BPA-free containers, but let's talk first about chemical substitutions, and then we'll get to that BPA question later on. So chemical substitution is actually what is called a safety control. It's actually one of the best controls out there, as opposed to the best one being just removing completely any chemicals, which is almost impossible. So instead of removing that chemical completely, you may want to substitute it for something that is less toxic. So I'm sure we're all going to look at this cat video forever. Maybe we could just do that for 15 minutes. But this really fulfills a very important purpose here. We do want to minimize our exposure to toxic compounds. However, we have to have enough information to know that what we replacing that toxic chemical with is actually less toxic. Otherwise, all that we're doing is what this little cat can do forever, which is just replace something by another and play this whack-a-mole game, but we're not any safer at the end of it all. So it actually requires a lot of information, and this is where the solution part comes in. Unfortunately, when we do a bad job at that assessment, we end up in a situation called regrettable substitution. So we replace a chemical by another one, and it turns out that that other one is not necessarily safer. We have some famous examples of this. I will go quickly through this one. Dichloromethane, this guy, does a very good job as a solvent, does a very good job at removing grease, or it can be used also as a paint stripper. Interestingly, you also make decaf coffee with it. However, it's extremely volatile, so it's very unlikely to remain in your coffee, your decaf coffee, especially after roasting. But because it's extremely volatile, people that who actually work with it can get really acute inhalation exposures. And the sort of symptoms of that can range from, depending on the dose, as we heard from Bernie, from dizziness, headache, and fatigue to actually loss of consciousness, coma, and death. And unfortunately, people who try to refinish bathtubs in their own homes, actually professionals who do that, can, if the bathroom is not ventilated well enough, can actually get really high levels of exposures. And there's been more than 14 deaths from professional bathtub refinishers reported since, I believe, the mid-2000s from this chemical. So people did not feel comfortable using it. I decided to replace it with this other chemical called N-hexane. It made sense because from several types of animal studies, it was shown to be about 15 to 20 times less toxic than the previous one. However, especially in occupational settings, people who actually work with this chemical, there were quite a few incidents reported, including a sort of famous one in a Chinese factory where iPhones are made, where there was acute cases of poisonings. And importantly, it was also realized that while N-hexane in itself might be relatively okay, we actually metabolize it. Well, and it's not completely okay. I shouldn't say that, but on top of its inherent toxicity, it's actually metabolized into compounds that have been shown to be neurotoxic and actually cause neuropathies. So then now we're moving to the next one, which is N-heptane, and we'll see, I guess, what happens in a way. It's still a little bit of a black box. So, regrettable substitutions, we might actually be in the midst of it, and this is where the bisphenol A question comes in. So you may be familiar with BPA or bisphenol A. It's a plastic manufacturing chemical, not necessarily a plasticizer. I should have changed that. It's actually used extensively in a plethora of products that you will find almost everywhere, really. Your plastic bottles, the clear, hard ones, not the soft plastic one, the really hard ones, like the ones that you'll go hiking with, or that a lot of students still carry with them. Those are made of BPA. The lining inside of aluminum cans are made of BPA. Dental composite and thermal paper as well. So BPA has been a little bit controversial, I would say. There's definitely camps on whether it's safe or not. What people agree with, at least, is that at high doses, there's very clear reproductive and developmental toxicity, as well as many others, actually. But my work in my own lab is actually focused on reproduction, and so I always like to highlight that fact. It's been banned by FDA, sorry, in 2012 in baby products. And actually more by something called abandonment, where the FDA said, well, manufacturers are not using BPA for baby products anymore, so why don't we just decide that we shouldn't be using it anyway? It turns out it's actually in a plethora, as I said, of other products anyway, and you will find that little green leaf on the bottle. So I want to show you what BPA looks like, and then this is what you'll find in your BPA-free products. Molecules that are technically not BPA, but if you actually just look at their structure, they're actually extremely similar. So it's not because they look alike that they necessarily have exactly the same kind of activity, but unfortunately, manufacturers went ahead, and you actually find these two substitutes, as well as many others that, again, sort of look like BPA, in all these type of consumer products that I talked about. We find BPS and BPF, these two substitutes, the most prevalent ones. You actually find them already in a large amount of the population, and in some cases at levels that are even higher than those of BPA. And in countries like Japan that have starting to do this substitution much earlier than the US, BPS, for example, is already at higher levels than BPA overall. And unfortunately, these substitutes are not unsafe. So we have Nancy Wainwright here, who was one of the first ones to publish the fact that this really nice comparative study between BPS and BPA showing that it does affect reproduction. My lab was on the heels of this, showing that germ cells, so oocytes, are also affected. It can also make mice obese. And I really would like to point out a review done by TEDx, and we'll actually have a speaker from TEDx later on, published in Environmental Health Perspectives, that actually is a review of reviews. So it went through the literature and really highlighted the similarities and differences between BPS, BPF, and BPA. And again, the conclusion is that they're not necessarily identical in terms of activities, but none of them is necessarily safer than the other. However, you have that little green leaf on your product, and so you're likely to go and buy it. So this is the first bit that we have to talk about, that chemical substitution, and again, we'll have some solutions at the end. Now, the next one is, I believe, is even more worrying, the next hot topic in toxicology. It's that question of heritable toxic effects. So it will sound a little bit far-fetched, but we actually have some evidence of this. The question is, can, let's say, an exposure to your great-grandparent affect your health now? Or if you are exposed right now, let's just move it forward. So if you are the great-grandparent, then could your great-grandchild be actually showing some health effect from your exposure many, many generations down the line, right? I mean, upstream, so 4 generations ago. So again, this sounds really far-fetched, but unfortunately we have some evidence of this. So let me walk you through the different generations, and I'll just give you some examples of this phenomena. From a parent to a child, especially if you have that in utero exposure, right? So a mother is pregnant with a child, the mother is exposed. It's actually a direct exposure to the child. And we have many pieces of evidence of effect on the child. I just chose 2 sort of famous ones. One actually stemming from World War II, where mothers were deprived, pregnant mothers were deprived of food, so they were actually under starvation. And it turns out that their children showed signs of obesity much later on in life, like 20 years later. The sons especially, the sons were studied, and the sons showed an increased BMI. And people are still trying to figure out exactly how this happens. There's another really unfortunate story with diethylstilbestrol, a synthetic estrogen, where the pregnant mothers took DS, and then many years later, 15, 20 years later, the daughters actually showed a high rate of vaginal cancers, and the sons showed genital malformations. Now, we actually know that, at least with the story of DS, this actually seems to be transmissible, so that the grandsons also show genital malformation. So now we actually are going from a grandmother to the sons or daughters to the sons or daughters. So we're already at 3 generations here. So the 4th generation, that's actually a bit more complicated. There's not enough time that has passed for those DS stories or famine to really know whether things could go all the way down to 4 generations down the line. But unfortunately, we have some evidence that this could happen based on animal work. So experiments done in mice, in fish, and in worms showed that all these different chemicals, dioxin, bisphenol A again, arsenite, and also starvation, can actually be heritable across that many generations and even beyond just 4 generations. Okay, so again, we'll talk about solutions at the end. It's not all bleak. Now, before I talk about solutions, I want to also talk about the fact that toxicity is not almost like a personal problem. We export our toxics all around the world. And there's no, I think, clearer picture than when we think about e-waste. So I just told you that with that question of annexane, that workers in China, when they make your iPhone, some of them got poisoning in the early 2010s. Well, once you're done with your iPhone and you just bought the new iPhone, I don't have an 15s, I don't know what. Well, you take your old iPhone and you send it away. Where does it go? Well, it goes in a giant pile. It goes into a giant pile of e-waste. E-waste, I won't take you through those numbers, but it's a very significant amount of e-waste that the Western world is producing. And I'm introducing the concept of Western world because when we are done with those chemicals or with those products, we outsource them outside of North America. A lot of the products in North America will end up in Asia, and a lot of the products in Europe will go to Eastern Europe, Africa, and some parts of Asia as well. And this is not without consequences for the people in these countries. I think you know where I was going with this. So even chemicals that have been banned for a really long time, because some people hang on to their electronics for a long time, even these chemicals have been banned for a long time, end up affecting the workers who dismantle these electronic products. And children, so even people that are not working in these factories, but children that live in these areas where e-waste are being accumulated, show, this is just one study, there are actually many, show higher levels of lead in their blood. So we're really outsourcing our own toxicity to other countries just so that we would be safer here in this country. So again, this is not necessarily a happy note here, but there are some solutions. And I just want to give you a glimpse of what those solutions could be. We can try to be on the more prevention side of things. We can try to have a greener approach to chemistry where we really try to get as much knowledge about these chemicals as possible so that not only are we safer here, but we also don't export toxic chemicals elsewhere. So I won't necessarily give you all the details on this, but I wanted to tell you, and we already mentioned a little bit of politics, but that there's a lot of labs around this country, labs at universities, but also labs within the government, NIH, especially the National Toxicology Program, as well as EPA and the FDA that have actually partnered together to get as much information about chemicals as possible right from the get-go so that we can make a very well-informed choice of which chemical is safer to use. So we can do this instead of starting with mice, we can actually start with cell culture or maybe small animals, try to get as much information about multi-generational effects, for example, transgenerational effects, as possible. This is actually in full gear now, especially, as I said, in those governmental labs. The goal, and I don't think we're that far off from completing it, is to screen about 10,000 chemicals in dozens and dozens of assays, not, and definitely for a subset of these 10,000 chemicals in actually hundreds of assays. So having all this wealth of information, once again, will allow us to really make sounder choices when we decide to make these products with chemicals. All right, I will end on this. Thank you for your attention.